Imagine a summer vacation turned nightmare. A family checks into a hotel, excited for relaxation, but days later they're battling high fevers, racking coughs. In hospitals, stays struck by an invisible enemy lurking in the water. Legionnaires. Disease doesn't just steal health. It shatters trust in the places we feel safest. Every mist from a fountain, every shower, could hide a danger that's entirely preventable. This isn't just a disease, it's a call to protect our loved ones from silent, avoidable threats. Legionnaire's disease is a severe form of pneumonia caused by Legionella bacteria. Below is a comprehensive overview based on current knowledge, including causes, symptoms, diagnosis, treatment, prevention. What is Legionnaire's disease? Legionnaire's disease is a type of bacterial pneumonia caused primarily by Legionella pneumophila, though other Legionella species can also be responsible. It was first identified in 1976 during an outbreak at an American Legion convention in Philadelphia, hence the name. The disease is contracted by inhaling small droplets of water or aerosols containing the bacteria, or less commonly by aspiration of contaminated water. It does not spread per santo person. A milder, non-pneumonic form of the illness is called Pontiac fever, which causes flu-like symptoms but typically resolves without treatment. Legionnaire's disease full details give. Legionnaire's disease is a severe form of pneumonia caused by Legionella bacteria. Below is a comprehensive overview based on current knowledge, including causes, symptoms, diagnosis, treatment, prevention, and more. What is Legionnaire's disease? Legionnaire's disease is a type of bacterial pneumonia caused primarily by Legionella pneumophila, though other Legionella species can also be responsible. It was first identified in 1976 during an outbreak at an American Legion convention in Philadelphia, hence the name. The disease is contracted by inhaling small droplets of water or aerosols containing the bacteria, or, less commonly, by aspiration of contaminated water. It does not spread per santo person. A milder, non-pneumonic form of the illness is called Pontiac fever, which causes flu-like symptoms but typically resolves without treatment. Causes and transmission bacteria. Legionella thrives in warm, stagnant water environments Y-113 degrees Fahrenheit or Y-45 degrees Celsius, such as hot tubs, cooling towers, plumbing systems, air conditioning units, and decorative fountains. It can also survive in soil or freshwater environments. Transmission. Inhalation of aerosolized water droplets containing Legionella, for example, from showers, misters, or cooling towers. Aspiration of contaminated water, for example, during drinking, if water goes into the windpipe. Rarely. Exposure to contaminated soil. Risk factors. Age. People over 50 are at higher risk. Health conditions. Chronic lung disease. Weakened immune systems, for example, from cancer, diabetes, or HIV, smoking, or organ transplant recipients. Environmental exposure. Staying in hotels, hospitals, or cruise ships with poorly maintained water systems. Outbreaks are often linked to large facilities like hotels, hospitals, or office buildings with complex water systems. Symptoms typically appear 2 to 14 days after exposure and resemble severe pneumonia. Common symptoms. High fever, often greater than 104 degrees Fahrenheit or 40 degrees Celsius. Chills. Dry cough may become productive with mucus or blood. Shortness of breath, chest pain, pleuritic pain, muscle aches, and fatigue. Headache. Other symptoms. Less common gastrointestinal issues, nausea, vomiting, diarrhea, confusion, or other neurological symptoms. Pontiac fever. Milder symptoms like fever, muscle aches, and headache, typically resolving in 2 to 5 days without treatment. Complications. Untreated. Legionnaire's disease can lead to respiratory failure, septic shock, acute kidney failure, multi-organ failure. Death fatality rate is approximately 10% overall. Higher in hospital-acquired cases or immunocompromised individuals. Diagnosing. Legionnaire's disease requires specific tests. The symptoms mimic other types of pneumonia. Laboratory tests. Urine antigen test. Detects Legionella antigens. Quick and widely used but only reliable for L. pneumophila, serogroup 1. Culture growing Legionella from sputum. Lung tissue or respiratory secretions, gold standard but slow, and requires specialized media. PCR polymerase chain reaction detects Legionella DNA in respiratory samples. Fast and sensitive. Serology. Blood tests to detect antibodies, though results take weeks and are less useful for acute diagnosis. Imaging. Chest X-rays, or CT. Scans show pneumonia-like patterns, for example, lung consolidation. Clinical evaluation. Doctors consider risk factors, travel history, and exposure to water systems. Treatment: antibiotics. Preferred macrolides, for example, azithromycin or fluoroquinolones, for example, levofloxacin. Duration: typically 7 to 14 days, longer for severe cases or immunocompromised patients. Intravenous antibiotics are used for hospitalized patients, switching to oral as condition improves. Supportive care: oxygen therapy or mechanical ventilation for respiratory distress. Fluids and electrolytes for dehydration or shock. Hospitalization: severe cases, especially in older adults or those with comorbidities, often require ICU care. Pontiac fever usually resolves without treatment. Prevention: preventing Legionnaires. Disease focuses on controlling Legionella in water systems. Water system maintenance: regular cleaning and disinfection of cooling towers, hot tubs, and plumbing systems. Maintaining hot water systems at is greater than or equal to 140 degrees Fahrenheit, 60 degrees Celsius, and cold water at 68 degrees Fahrenheit, 20 degrees Celsius. Flushing infrequently used water lines, for example, in hotels or hospitals. Public health measures: monitoring and testing water systems in higher-risk settings, hospitals, nursing homes, hotels. Prompt investigation of outbreaks to identify and remediate sources. Individual precautions: avoid exposure to aerosols from poorly maintained water sources, for example, decorative fountains. Smokers or those with chronic lung conditions should be cautious in higher-risk environments. Epidemiology: prevalence: Legionnaire's disease is underdiagnosed, but accounts for 2 to 9% of community-acquired pneumonia cases. In the U.S., approximately 6,000 to 7,000 cases are reported annually, though the true number is likely higher. Outbreaks often linked to large facilities, for example, hotels, cruise ships, hospitals. Notable outbreaks include the 2015 Bronx, NY outbreak, 138 cases, 16 deaths, and the 2019 Atlanta hotel outbreak. Seasonality: cases peak in summer and early fall due to warmer water temperatures. Global impact: occurs worldwide, with higher incidence in industrialized countries due to complex water systems. Prognosis with prompt antibiotic treatment. Patients recover fully. Fatality rates vary. Community acquired: approximately 10% hospital acquired or immunocompromised. Up to 25 to 40% long-term effects may include fatigue, respiratory issues, or neurological symptoms in severe cases. Public awareness: many cases are sporadic and the source of infection is often unidentified. Public health campaigns emphasize water system safety. Research: ongoing studies focus on improving diagnostics. Understanding Legionella ecology, developing better water treatment technologies. Legal aspects: outbreaks may lead to lawsuits against facilities for negligence and water system maintenance.